guys, welcome back to my YouTube channel. My name is Na Odale Kosh Adoma, and today we'll be talking about what to do if you notice somebody close to you is in mental distress. I previously did a video about how to tell if somebody is in mental distress, and now this is a follow-up video to that. Once you are able to identify signs and telltale signs of somebody who is in mental distress, these are the things you are supposed to do. But before we go into this, I'd like to say that this video does not constitute a psychiatric or psychological advice. Please speak to a professional in times of dilemma. When there's a new case of mental health disease, the first thing to follow is denial. Most people will deny this is a clear case of mental health situation, even with the symptoms and everything. This is because of the stigma that is attached. Many people would not like to be associated with it, and then they would rather blame it on other things, spiritual attacks, curses, or sometimes as punishments of some evil doings that they had performed in the past. And sometimes it can get so bad that the sufferer is tagged a witch or a wizard. I am not saying none of these things exist, because of course I'm not an expert in the medical field nor the spiritual field, but I have seen a lot of evil spirits run away with medication that I know medication works. I have seen a lot of situations that were tagged evil spirits, curses, that once the person got medical treatment, the evil spirits ran away. So it doesn't matter what you want to attribute it to, just make sure that you had the medical care to it. Yes, and then also, treatments are the job of a professional, a psychiatrist or a psychologist. As lay people, we cannot diagnose nor treat mental health diseases. It is just not in our fields. No matter how many books you read, if you are not a trained technician or doctor or specialist, please do not try to cure somebody or give somebody healings or concoctions for their sicknesses. These are strictly the job of professionals, a psychiatrist or a psychologist. But as lay people, these are what we do. This is what we can do to help them. This way, we do not have to be in denial, because the denial is mostly because people do not know what to do with the situation. So the first one, when you see somebody suffering from any form of mental health disease, and then you are able to approach them and talk to them. If you see anybody suffering from mental health diseases and they want to talk to you, make time to talk to them. Set up time without distractions, that you do not have to get up and go and come. Just make time for them. Sit with them and talk to them. Make the conversation about them. Ask them what they feel. Ask them what they want. Just make it about them. Do not try to push your ideas on them. Just make it about them. Give them the time. Let them talk, and then let them express themselves. Once you are talking, just make sure that you don't force them to talk too much. And that is my second point. Allow them to say as much or as little as they want. This is about them, and let them talk about the things they want to talk about. Do not try to make somebody tell you things they are not ready to, pulling information out of them and then causing them to sometimes pull back, because talking about these things can be very, very difficult. So if you force them too much, they might recoil. For all you know, you are the only person they felt comfortable talking to, and once you cause that to happen to them, that is, you've lost them, and then they might recoil in their shell, and their disease or sickness might become worse. Do not try to diagnose them or second guess their feelings. Like I said, you are not a doctor. You are not a trained physician. So do not try to diagnose anybody. This is very, very important, that do not try to diagnose. And then when it comes to feeling, and somebody says, I feel this way, you cannot tell them to feel differently. Don't second guess them. Don't tell them they are not feeling it. You cannot really determine somebody's feelings. Their feelings could be right or wrong, but you cannot tell them what to feel. Once you listen to them, you do not have to agree with them. The only thing is that you show up for them and make them know that you understand them. Talk about well-being. Talk about things that would help them to come out of these situations or help them manage their stresses better. So things like exercises, like talking, like going to yoga, going for walks, changing of diets, meditation. You just bring up such conversations. If it's possible for you to even lead them in some of those things, then you tell them, no, let's go for a walk. Let's go sit somewhere and take a drink. Let's go relax. Those are things that you would if you discuss it with them or bring them along, would help them very well, because exercise helps a lot when it comes to stresses, and this will help them manage their stresses better. The final one is to know your limits. Know your limits. You are not a professional, so know your limits. Everything I have said today is about knowing your limits. Know what you can say, what you cannot say, what you can do, what you cannot do. But most of all, know you are not a professional. Help them to seek professional care. Help them to seek professional care. If the person is not a very close family member or somebody you have no authority over, and you realize that things are going too far, and then the person is quite serious, talk to the person's primary health care deliverer or primary carer. That is a parent, a sibling, or a very close family member who can help them seek medical care. So you help them, but know your limits. So I'm going to go through them all and list them one after the other. So the first one is that you would make time for them and talk to them. You let them talk, make it about them. You do not have to agree with what they say, but you understand where they are coming from. The second one will be to let them say as much as they want or as little as they want. Once they open up to you to talk to you, do not push them too hard. Do not pressure them to tell you things they don't want to tell you. Do not lead them in your conversation. Manage your conversation. Let everything come out of them and do not lead them. Don't tell somebody, it seems like you are angry. It is best you ask the person, how are you feeling? The third one, do not diagnose anybody or second guess their feeling. You are not a professional and you are not their body. You cannot tell them what to feel and how to feel. They feel the way they feel, and what is important is that you understand them and then you assist them. The fourth one is well-being. So you talk about things that will improve their well-being and then their health. Meditation, exercise, diet. And then in most cases, if it's possible for you to lead them on these things, it would be great. So you call your friend or your sibling or whoever to go on a walk with you. You tell the person, let's go to Every Gardens and enjoy some serenity. Just help these people with things that will improve their well-being, because this will also help them manage their stresses, which is a big factor when it comes to mental health cases. And then finally, know your limits in everything with mental health sufferers. Know your limits. You are not a professional, so you cannot diagnose, you cannot manage, you cannot cure. So know your limits. Know as much as you can say. Know what to do and what you cannot do. And if the person that is suffering is not a close relation, please talk to their primary carer. That is a parent, a family member, a sister, anybody close to them, and let that person help them. You can support them, but if they are not your primary caregivers, please speak to who is in charge and help them get medical care. So these are the 5 main things that I would suggest that you do in times of a family member, a friend, an associate, an acquaintance having mental distress. Because people do not know what to do, they try to deny or attribute some fact. If you know these tips, please use them to help those people that are around you, to help them manage their well-being and get better fast. We upload videos every Wednesday, so please like and subscribe to our channel, and we'll see you next week. Bye.